women's health research, maybe some folks in America aren't aware of this. They haven't for centuries, but we've never dedicated the type of money or resources to do in-depth research on what ails women, what could cure women, and many times we're using the research that was done mostly with men to help figure out how to keep women healthy. Sometimes it works, sometimes it doesn't work so well. And we're here at Cedars because they actually have a center that does research for women. And it happens that President Biden and First Lady, Dr. Biden, have announced that we are going to get in this game. We want to get in big because it is important to do health research that is focused on women's health. The initiative, the White House initiative on healthcare research for women has taken off. At the Department of HHS, you can imagine we are going to be very busy because so much lies within our jurisdiction. And we have 45 days from launch, which was back in November. So December 28th, as I mentioned in there, nothing's going on around that time, but we'll figure out how to make sure that we deliver on that promise to come out with solid recommendations on how we can improve the research that's done.
Okay, in your remarks, you talked about, customized approach, but some women, particularly Black women, they feel neglected, like their voices are not being heard and their complaints are not being taken seriously. How can you cure this overall throughout the healthcare industry?
So whether you're a Black woman, a white woman, a Latina, or a man of any of those different ethnicities, what matters is having information about who you are, and whether it's because we've taken your blood and we're examining that, or because we do an MRI, we can get a good idea about you and your body. What we're trying to do here, though, is make sure that the research that's been done to tell us how to treat you and your body with the medicines that are around actually are tailored to meet your needs. So as we get closer to doing this precision medicine, personalized medicine, that pill that we're now trying to personalize can really be personalized for you based on your data, your personal data, but also because the research that was done on people who are like you. You're going to be much more like a woman than you are than a man. And so that's the point.
My follow-up, that research sometimes for the communities that may be skeptical, the disadvantaged and marginalized, that sounds like experimentation. How do you, teeter between those two? Because
it's not just eat.
Okay, this is not experimentation,
No.
because when we hear research, how do we
just
know? How do we ensure that?
Let me give you an example, because we know that sometimes as we approach communities, they're a little skeptical. Sometimes they have reason to be. We're doing research, for example, right now at the Department of Health and Human Services within the National Institute of Health on long COVID. It happens that a lot of people of color are suffering long COVID in bigger numbers than our folks in the white community. We wanted to make sure that our clinical studies reflected the population that's suffering from long COVID. So we made a concerted effort to make sure we got folks from the Black community, Latino community, Asian community, white community, men, women. And so the same thing applies here. We have to make sure that as we begin the research, the people who are doing the research, the investigators, and the people that are participating in the clinical studies, subjects, all know what's going on. But I would encourage Americans of all stripes to please participate. Because if you don't, then people like you will have to depend on pills and medicines that are based on people that aren't.
Thank you.